Let's talk about stretching a little bit. So the question would be, should you stretch? You get so many different opinions on this. You have people saying, yes, you should, no, you shouldn't, it's not beneficial, it's everything. There are entire programs based around stretching, and some of them are valuable and others might not be so valuable. So what can you do to make sure that you're getting the most out of stretching? One of the first things I would look at is, why is a muscle tight? Now, is stretching a muscle or a tissue the right idea? Maybe it's not. Maybe it has a protective function. So that's the first thing that you need to figure out. Is it tight just because you've been sitting a lot? Or is it tight because it's protecting you from an injury? Remember that your body is not just a single muscle by itself. It's a closed chain system. It's interconnected. So if you truly believe, or you've had an assessment and someone says yes, that indeed this is just a tight muscle for whatever reason, and you've established that, then you can start to look at the how. But always start with the why. Why is the muscle tight? Why is the tissue tight? And if you know that there's not another underlying reason to that, then it makes sense to get into stretching. Now, once you've established the why, perhaps you've had an assessment by a physical therapist or a chiropractor or a physician who's trained in these type of things, then you can start to determine the how. And I think over the years I've started to see varying degrees of success with different types of stretching. I think the old way of stretching with long static holds is not as effective as an active stretch. An isolated active stretch over and over is more calming to the nervous system than, say, a 30-second stretch a couple times. So a lot of times when I have clients stretch, I have them do maybe 3 to 4 second hold. Once they've lined everything up correctly, they go into the stretch, they back off. They go into the stretch, they back off. Now, I found that works a lot better. But you also have to think about, what are the other components in stretching? Do you have a tight joint capsule? Do you have something neurologically that's restricting you from getting a better stretch? So if you're stretching over and over and it's not working, then it's time to look at some of the other underlying causes of a tight tissue. I hope this is helpful, guys. I have some videos on improving your hamstring stretch, improving your piriformis stretch, and I'm also doing a video on improving your hip flexor stretch. There's hip flexor stretches. I think that you'll find some value in those. If you found this helpful, please go ahead and subscribe, and we'll continue to dive more into learning your body at a deeper level. Thanks a lot, guys. If you're really tight, you might barely move. Even just putting your leg in this position and then squaring your pelvis up in three planes of motion might be enough so